Africans analyzing their problems within their context and then coming up with the needs that are tailor-made to those problems.
Hello and welcome to Dr. Story, everyone. As a continent, Africa's overall economic and demographic fundamentals present a strong case for investment in healthcare, with the private sector playing a pivotal role. With increasing urbanization and a rising middle class, the need for specialized care, health innovation, and health tech continues to be prevalent. Today, we have with us a very special guest joining us directly from East Africa, Dr. Mamello Muhanuuzi, a medical doctor and a healthcare management specialist currently working as the lead consultant at Mayline Africa, a Kampala-based health advisory and consulting firm supporting new and existing healthcare organizations to improve their business and operational performance. With a career spanning over a decade, she has been privileged to hold senior leadership positions in the leading private hospitals, sharing her knowledge and expertise to shape the private healthcare landscape in Uganda. She was nominated as one of the top 40 under 40 individuals 2019 by one of the leading dailies in Uganda for demonstrating outstanding leadership, and has also spoken at local and continental conferences on issues related to digital health, telemedicine, and institutional preparedness in the face of COVID-19. Such an honor to be in conversation with you today, Dr. Muhanuuzi. Welcome to Dr. Story.
Yes, thank you so much, Anshal. Thank you for having me.
So if we could, get a sneak peek into your journey, tell us more about you, your professional goals and aspirations.
Okay, so Anshal, my story began in Kenya. I was born and raised in Kenya. I did my early childhood education in Kenya. I was born to a Kenyan mother and a Ugandan father. And then pursued my high school studies, and then went on to the University of Nairobi to pursue my medical degree. I then moved to Kampala, Uganda, which is a place where I can say that I have really started my career journey. So I really started from the ground up, medical officer. And then along the way, I was given a leadership opportunity. And I can say that was really the fork in the road for me in terms of whether I should pursue a clinical degree or whether I should pursue a non-clinical pathway. And at that point, I was given a role of a senior clinical head for one of the clinics under the organization I was working with. And that really cemented my interest in healthcare management and leadership. Since then, I have then gone on to, hold a number of leadership positions, as you've mentioned in the intro. And all these have really helped to shape my perspective around healthcare leadership, healthcare governance, and really just understanding what are the challenges around running a healthcare institution. How then do we run sustainable institutions amidst the challenges that exist, especially in Africa? So I am currently, as you rightfully mentioned, the lead consultant at an organization called Mayline Africa. And what we do is that we support businesses to improve their performance, both operationally and really from a business standpoint. Okay. And for me, this really speaks to, my professional aspirations and goals, because I do want to be a part of a larger story in terms of private healthcare. And that story can only be told around sustainability. 50% of Ugandans right now, when they do seek healthcare, they will seek healthcare from a private facility. And so having an opportunity to work with different entrepreneurs, to work with different organizations, both new and existing, and even those that want to come into Uganda, to help to ensure that they put in the right mechanisms, put in the right processes, are able to improve their internal operations so that they are sustainable is really a very big and important part of my career, and where I see myself, 5 years from now.
Right.
So in a nutshell, that is my story.
Great. So inspiring.
Yeah.
Okay, so when we talk about
Mhm.
Africa as the continent, do you feel there exists a dichotomy between the actuality and what people actually interpret? So the perception of the world versus the reality.
Yes, so Anchal, yes, definitely there is a dichotomy in terms of the perception of Africa, and this is really based on a number of circumstances that have really existed in the African continent. There have been so many challenges that said from the time, when most African countries gained their independence and started to self-govern. And of course, health has not been without, exempted from these challenges. However, we've reached a period in our history where we are, starting to review the Africa that we want versus the Africa that has been, the case study over the years. And I think this has become very important, because then it is Africans solving African problems. Africans analyzing their problems within their context, and then coming up with the needs that are tailor-made to those problems. And Africa is a very diverse continent. We have 52 countries, and we speak so many different languages. And I think that has, in the past, has gone unnoticed or unappreciated. But right now, it is something that, both us within the African continent, but also external other foreign countries or countries overseas, are beginning to understand that, whatever may work for one country may not necessarily work for another.
Yes.
So definitely there has been that difference in terms of perception and reality. But my take is that it's the onus is really on us as Africans to determine how we want to be perceived, and to determine our own realities in terms of either the services that we are giving to patients, or the infrastructure and the facilities that we construct in terms of healthcare, the services that we offer outside, the allied services that are offered outside the doctor-patient relationship. So all that is still within our power, and can also help them to shape the perception that has been out there.
True, absolutely. So coming to the telehealth that you mentioned, for the audience to understand, telehealth again encompasses a variety of telecommunication technologies, right? That is specifically from a distance. And owing to the pandemic, telehealth has also surfaced big time. So what do you find, how it has enhanced the communication with patients, or how successfully it was and is being implemented there?
Yes. So telehealth as a form of Healthtech has really been instrumental in bridging the gap between the patient and the doctor. And even though telehealth, began to really come up as a modality about 10 or so years ago, it has been it has leapfrogged because of the pandemic that we have just been through, and the lockdown measures that that were taken by many different African countries to try and protect the population from the disease. And so what happened is that all of a sudden there was this enlightenment and awareness around the fact that you could see a doctor without necessarily having to see the doctor physically.
Right.
And there was an appreciation from patients that, I may not be able to go to the doctor at the facility, but I could actually go through a certain platform and actually get the doctor to see me and appreciate the symptoms that I have and treat me in a manner that would have been the same whether I was there physically or not. So for a number of companies that had invested in this form of health technology, they did see quite a tremendous growth in terms of consultations, in terms of business. I did attend a report from one of the leading telemedicine providers in Uganda, and they spoke of having a 300% growth in their teleconsultation.
Wow.
So you can imagine this is really, really tremendous in the sense that all of a sudden people were very willing to embrace this as a modality in terms of seeking healthcare. What we have found though is that even in as much as there has been that acknowledgement, it seems only to have taken root in the urban areas, and therefore there is still a semi-urban population that stay in the cities that are outside, let's say for instance Kampala, that yes, they do hear about telemedicine, but they actually haven't experienced it. And for me, that speaks to opportunity, because once we have the key urban populations taking it up, in our public health, we call them the early adopters. Then you're able then to say, okay, if this has worked for them, what have been their challenges? What have been their concerns? How do we address them so that then the next phase of those people who then tend to come up into an innovation later after the early adopters, what can we do to make that onboarding much easier and much faster? So the population is open. People have embraced telemedicine. Most importantly is the doctors, because I remember hosting telemedicine webinar very early in the pandemic, around March of 2020. And the reason why we had this webinar was because all of a sudden we are in this medical facility. Patients have been coming to this medical facility, but now there's a lockdown and patients still need continuity of care, but the doctors are not able to access their patients and the patients are not able to access the doctors. So we needed to lead that conversation on how do we embrace telemedicine so that our patients do not feel abandoned. And what I realized from that whole discussion was that actually, even from the medical fraternity, there had been a sense of, I would want to see a patient from a telemedicine platform, but what is the acceptability? How would it work? How would we implement it? For instance, if we are already an established hospital, how do we then go and implement it and then cascade it at some point with inpatient care or physical attendance? So that helps to open up the in terms of the misperceptions around telemedicine, but it also gave an opportunity to the medical fraternity to buy in to the idea of telemedicine as an option of delivering care. So I think in terms of digital health, in terms of telemedicine, it has really, really been a lifesaver for some people.
Absolutely.
Yeah, it has really been a lifesaver.
So as you mentioned about opportunities or investments, from your perspective as a healthcare professional and being an expert in this sector, what are the more investment of the territory of health sector in East Africa specifically?
Yes. So in any scenario where you're investing in an African setting, it is essential to understand and to carefully prioritize how you make the investment. And usually it would be investing in the health system blocks. In the health system, we have the key blocks like the governance, the health workforce, the health systems technologies, healthcare financing, and health infrastructure. And so that notwithstanding, it's important to look into these areas, and then from them, then we can now begin to say where are the opportunities. So currently in Africa, definitely we do have opportunities around medical equipment and technologies. So health tech is still a very welcome an investment area of opportunity. Investments around health infrastructure, setting up the facilities and having more people being able to access both primary and tertiary level kind of care. There's also opportunities around improving the quality of the workforce. So any opportunity to reskill and upskill the healthcare workforce is also an opportunity that should be explored. And then finally, of course, the essential commodities. That is also a very important aspect, the sundries and the health commodities that are used, the pharmaceutical drugs and all that. That is also an avenue for investment. And therefore,
immense opportunities. Yeah. So it's about education, it's about management, as you said, and it's infrastructure and telehealth, of course, right? Great. Such an amazing experience being in conversation with you today. Thank you for the insight into Africa's health sector. And we truly appreciate the time we took off for the discussion. Thank you so much.
Thank you so much, Anshal, for having me. It's been a real pleasure.